Is your doctor good in bed? Well, most doctors in India are not, at least when it comes to explaining to their clients what to do with their partners in bed. Hi, my name is Sangeet Sebastian. I have been reading, writing and researching on sex for over the last 12 years, and in this episode of Vvox, we will discuss how to choose the right sex doctor with Dr. Narayana Reddy, a Vvox expert and a fellow of the American College of Sexologists. Have you ever felt that your doctor has been prescribing a lot of unnecessary medicines and tests without really understanding the problem behind the difficulty? Now imagine if that doctor is also not trained. That is pretty much the situation with most sex doctors in India. That is because there is no sex education or sexual health training in the medical curriculum. After our last video, where we exposed the reality of India's sex doctors, I got a lot of questions from people asking me what exactly is the difference between a trained sexologist and a doctor who is a urologist, a gynecologist and andrologist, but also calls themselves sexologists without the necessary training. Many of you also wanted to know how to choose the right sex doctor, since there is no sex education or course to become a sexologist or a sexual medicine specialist in the medical curriculum. A urologist, a gynecologist and an andrologist are doctors specializing in surgeries relating to male and female urinary tract and reproductive organs. Most sexual difficulties like erectile dysfunction, premature ejaculation, performance anxiety don't require any surgery and sometimes even medication. In some cases, all it takes is just one good counseling. To do that, a doctor must be trained in the art of counseling and also in asking the right questions. Unfortunately, only very few doctors in India are trained to do that. And that is the reason why many people, especially those belonging to the LGBTQ community like the homosexuals, bisexuals and trans people, find it difficult to meet a doctor who understands them and treat them with respect. So then how do you choose the right sex doctor? The first and most important thing is to find out from which medical school the doctor has graduated. Next, ask the doctor from where he has trained in sexology. These days there are institutions like the JSS Medical College, Mysore, where doctors are trained in sexology. Now here is the thing, many doctors are not comfortable with their patients asking them questions. But that's okay. As a patient, you have every right to ask questions to your doctor and get answers for. And if your doctor is unwilling to answer them or reluctant to answer it properly, look for someone else. Many doctors in India are extremely moralistic and judgmental when it comes to matters relating to sexuality like accessing contraceptives or going for an abortion. Hence, it is important that you understand the sexual position of your doctor before beginning the consultation. So how do you find the right sex doctor? To know more about what to look for in a trained sexologist, I talked to Dr. Narayana Reddy, a medical professional who was the first to start a clinic focusing exclusively on sexual problems in South India way back in 1982 after his training in sexology from the US.
The question is, what is the difference between a trained sexologist and an untrained doctor handling sexual problems? In simple terms, the difference is the skill. The skill in obtaining a good clinical interview or sexual history of the couple. I tell you why. When somebody has got a physical problem, even if they don't open their mouth, and tell the doctor, "Doctor, I have pain here, etc." The doctor can palpate, that means touch that area, and if the patient winces with pain, the doctor understands and confirm the diagnosis. He can fall back on ultrasound, X-ray or whatever it is. Whereas when it comes to sexual problem, we can't touch and find it, isn't it? No sexologist can enter the bedroom of a couple and observe the sexual act to find out where the problem lies. Impractical. So, it is imperative that a good sexologist should be able to recreate mentally the bedroom dynamics of the couple in his consultation, in her consultation chamber. Otherwise, we cannot proceed further. This is a special skill. I'll give you a background. In general, all male problems were called impotence. All female problems were called frigidity. That doesn't give us any clue where exactly the problem lies. Now, in the medical curriculum or college, the doctors are first taught the normal functioning of the body organs. It is known as physiology. Once he or she learned that, the student, we are taught the pathology, the abnormal functioning. So, normal functioning, understanding, is important to understand the abnormal functioning. Till the 1960s, the medical fraternity has knowledge about heart, stomach, etc. But no medical doctor knew what was happening to the bodies during a sexual act. In the late 60s, the pioneering sexologist Masters and Johnson have done research and told us the physiological events taking place during the sexual act in the human bodies. Today, we divide the sexual act into stages, phases. First is desire phase. Then we have desire. Then we have the arousal phase, when you get sexually excited and maintain the excitement. Then we have the orgasm phase, where the man ejaculates and where the woman enjoys the perception of pleasurable sensation. A trained sexologist, by asking appropriate questions, knows where to slot this particular problem in the particular phase of the sexual response. Without that, nobody can do justice. If that has to be understood, the medical student has to be trained in that art. Unfortunately, the medical curriculum as of today has not included sexual medicine or sexology as part of the regular MBBS curriculum or even in the postgraduate level. with a net result. The doctors are as ignorant as the clients or patient. You must have heard the phrase, the physician is more embarrassed than the client. It is not the doctor's fault. They have not been trained. They have been trained in cardiology, they have been trained in gastroenterology, gynecology. They have not been trained or told about the sexual behavior of the human being, sexual act in detail. So how do we expect them to learn? So that is the lacuna. So majority of the doctors who handle sexual problems are blissfully unaware of the details and prescribe whatever they think is the problem.
So there you go. A majority of the doctors who handle sexual problems in India are blissfully ignorant about the details and prescribe whatever they think is the problem. Scary, right? Have you had a bad experience with an untrained sexologist? Tell us what you went through in 5 sentences or less, and we will make sure that your stories are heard. Thank you for watching. Please subscribe to our channel for more informative content on sex and sexual health. Until next time, this is Sangeet Sebastian signing off for Vvox. Just sex, no prejudice.